what I plan to do with you guys today is just to talk about what happened with the Global Network of Sex Work project, which Stella is a member, and I was one of these participants in this consultation. It was about PrEP and early treatment. And so I'm going to share with you some of the finding of the consultation and also concern from the sex working communities, not only from Montreal, but in a global perspective. So what we learned first in this consultation is that sex workers don't know a bunch of things about PrEP. And it's kind of a bit scary because we probably will be one of the community that will be target to use PrEP a lot since of our amazing sexual activities. And yeah, so that was the first finding of the thing. So I think for me, working at Stella in my own working community in Montreal was like, this is a start to start a conversation. And we will continue to do so for getting more informed and for having like a really to consent and to know more about this. So the thing was conducted in 40 different countries. So it's not only from a Western perspective, but it also was conducted in the Asia and the Pacific, and also in Africa. So our sisters and our brother there can share their consent, their concern with us. So yeah, so what we found out, what the NSWP found out also, is that a lot of sex workers were really skeptical about PrEP. Some of them said, okay, why we want to provide some medication, some drugs to people who are not still sick, and when a bunch of our sisters and brothers who are already HIV positive do not have access to treatment globally. So that was one of the concern. Some other concern was about the impact of the strategy on their personal health. So, yeah, like you guys have some study for PrEP, but the Truvada never been tested on the sex worker community right now. So it's something that we don't know the side effect yet. We've never been on hyper whatever on study, so we don't, we cannot know, you know, hyper sex workers study. Yeah, and we were worried also about the ethic and the application of this strategy, specifically with the legal context of sex work globally. So our rights are already violated on a daily basis for some of us. So yeah, it's a stress for us. So yeah, I'm gonna just move on with a couple of the concern. Yeah. Okay. Yeah, so people wanted to know if we don't have a data of a long-term use of Truvada on HIV negative person. And also some people wouldn't want to take PrEP because of the potential side effect. Some other shared Hey, thank you. Yeah, other sex workers' health concern was about sexual and reproductive health. So sex workers were sharing that they do not want to use PrEP when it only protect us from HIV and not STIs or pregnancy. So yeah, so sex workers, you know, it's really about working condition and all that stuff. So it's not just about sexual activities or being a slutty and whatever. So yeah, so that was another concern. And yeah, so it was also the concern was about how do we gonna justify providing treatment to someone who doesn't really need it over someone who urgently requires treatment if we provide treatment to everyone. So for sex workers, they have also concern about the testing as a precondition, since regular testing is already part of the government requires sometimes. So people were concerned if the PrEP is gonna happen with us. So so we don't want to have mandatory testing, and we wanted to we don't want to have like testing for sex workers without their full consent. So some people shared they wanted to know if PrEP is going to be another way for the government to control us and to force us to get testing and to register. So there was always another concern about the police harassment that we already face in a lot of places and also in here in Montreal. So the police constantly looking and searching for condom as evidence of sex work. So people, they were concerning about the fact that maybe the pills could be also one of the evidence of sex work for sex workers. Another thing, it was about the right to say no and the confidentiality. So for us sex workers, it's already scary to go into the health system. And so some of us share if we could be able to say no to treatment, to refuse PrEP or to refuse testing. And also sex workers were sharing that it's always a great pressure for HIV positive sex workers to go onto treatment, but not really for their own self-care, but for the global community care, so we are not transmitting to the other person, it's not for us. Yeah, and so people were asking how can really the testing and the treatment can be confidential if it's already often non-confidential in many countries, like what happened in Greece when the sex workers HIV positive were arrested and their picture was all over. So this is some of the concern. Yeah. So as I said earlier, the PrEP was not tested in the sex workers community, so how do we know it's gonna suit our needs? We don't know yet. And some other said that the female sex workers have the lowest HIV infection. It doesn't include like sex workers who inject drugs as well. And they say that they have the highest rates of condom use, so they were like, maybe I'm not that at risk. So that was some of the question that was sharing by the participant. Another great concern for our sex worker community is the devaluation of condom use. So it's been years we worked so much hard to make the condom use in our sexual practice, in our work, to be like the norm. We fear that the usage of PrEP could make the clients think that we are all safe or whatever, and they can ask for more unprotected sexual act or sexual practice. So this was a big concern. So some were fearing that the PrEP might undo all the great work that we did for the condom use. And another thing, it was related to that also, it's about the negotiation of safer sex practice within sex work. So if everybody know that sex workers are on PrEP, it will be easier for clients to ask us some services without condom. And for some male sex workers, they are sharing that they're already facing a lot of demand for unprotected anal intercourse, and they were really concerning about that. So there is also a concern about the possible reduction of HIV testing, since these strategies could result in a decreased numbers of individuals being tested due to a perception that transmission has not occurred. And another concern was about the adherence for the treatment. So as sex workers, we often move around, so we're really mobile. We're working, some of us working internationally. So we want to be sure that if we move, we're gonna continue to have the access or no, so probably no. And some people are really afraid already, some of us who are HIV positive, we are already feared to travel with our medication, so we don't want to be outed for our occupation or status. And another thing was about the cost, and sex workers globally said that unless PrEP and other early treatment were provided for free, it won't work for the sex worker community. And they're actually, like, it's not all the sex workers globally who have access to HIV treatment, so it's probably gonna be the same for PrEP. Yeah. And yeah, as I said about the hostile legal environment, sex workers don't have really like an easy access to get tested, and about the legal context. So like here in Canada with the criminalization of HIV, so it's, yeah, scary. And so some sharing that, why would I want to risk carrying in anything that could be used against me in case of arrest? It is already problematic with condom. Who's to say Truvada might not be treated the same? So some other people share that when we get arrested, we already didn't get access to our medication, so what if we're on PrEP? Yeah, and about the healthcare setting, so it's well known, sex workers were not really welcoming, and it's not easy to connect with the primary care, let alone disease specific. So it's going to be the same with PrEP. So that was kind of concern, yeah, for the sex working community. And about stigma and discrimination, about being a key population, could it fall as the sources of HIV transmission? So some sharing the concern about why we target sex workers as the key population for PrEP, and they were asking if it will further perpetuate the image of sex workers as the source of HIV transmission. Yeah. So, yeah. I think in this consultation we find that it was a great new strategies, but we need to know more. For my experience, when I participate in that, I knew really nothing about PrEP. I only heard it with the gay community, so I didn't really feel connected to that, and now I'm getting more informed, and I see that for my opinion, I will not exclude PrEP, but I really want that sex workers are on the table and they can have really informed the best information, and to have space to talk about what we feel about PrEP and other strategy for our health. So yeah, I think that's it.